With more than 15 years of equine sports medicine and rehab experience, the visionary and founder of Performance Equine Vet Services, an equine performance innovative center. Your host, veterinarian Dr Rullan, is here to keep you informed on all things sports medicine, rehabilitation, and equine business. This is A Stride Above.
I'm here with Dr. Dr Ramstrom from Performance Equine Veterinary Services. Thank you for being here with us again.
Thank you for having me.
So today we are going to ask Dr. Colton, what's your favorite lameness problem to treat? What's your favorite problem to solve? And
That's an excellent question. I think in general, my favorite lameness issue to treat would be something that we can treat and that we can get the horse back to work. But as far as specific issues, I like working with front feet problems, not because they're easy to treat and easy to get the horse back to work, but just because they do require, a lot of investigation to figure out exactly what the problem is. Working with the owner or client as well as the farrier, and it's really a team effort to get those horses back to work. Be it a horse with primary navicular problems, a horse with deep digital flexor tendonitis, a horse with low ring bone or coffin joint arthritis. The collaborative effort between myself, the farriers, the client, the trainers, the horse, all of those things together, I find can be very rewarding, especially in those cases where we do get the horse back to full work and it's a big success. Another thing that I've had, quite a bit of success and enjoyment in treating is hawk arthritis. I think that's something that we see very commonly. Probably the most common joint that gets injected are the lower hawk joints, and that's because the horses get sore there a lot, and beyond just getting sore there, they also get arthritis in those areas a lot. And using a combination of different tools and treatments, be it shockwave, be it corticosteroids, orthobiologics, rehabilitation, obviously, all these different tools to be able to get the pain, the inflammation down in the hocks and get the horse feeling good and working good again.
that's awesome. I thought we were going to have a medical question, but you touched actually something more important than that, which is the team effort. And solving these problems, it is such an intricate job by multiple professionals. And you did such a good job explaining all these guys that are involved, from the groom to the owner, to the trainer, to the vet, to the farrier. Everybody is so involved. That is very, very good. How do you feel the team? How do you feel? Do you have any thoughts on what happened when someone tries to solve this problem without the whole team being involved? And some of them do get solved, But tell me a little bit about this. Let's touch on that a little bit.
Absolutely. No, and probably the most common issue that I will run into, or that clients will run into, is that they're hearing multiple different things. My farrier says this, my vet says this, my other vet says this, my body worker says this. And they're getting a lot of conflicting information. And that's very confusing for the owner who's trying to manage their horse and do the best thing for their horse, and they have multiple professionals all telling them different things. But it's also not good for the horse because there's confusion in the treatment plan, and so frequently the treatment plan is confused. So I think really developing a good relationship between veterinarian, farrier, chiropractor, body worker, client, horse, everybody being on the same page, having a full understanding of what the problem is also extremely important. That way, you know exactly what you're dealing with, and it's not some nebulous, he's kind of sore in the heels, let's do this. Like, no, we're dealing with the, flexor cortical erosion of the navicular bone. This is what I've done in dozens of cases, and it's worked well. Let's do this, and if this doesn't work, then we can, collaborate and try something else. Just really having that effective, established communication base between all the members of the team.
Absolutely. I highly recommend, with regards to the food, if you're a horse owner or a trainer, I really recommend you taking a looK at our book, equinefoodsecrets.com. It's a very simple, easy to understand anatomy guide of the food. That way you have an idea of what we're talking about, the terms that we're mentioning, talks about the bones, the tendons, the joints, etc. Something you mentioned really important, confusion. One mentor of mine says, where there is confusion, there is failure. A mind that is confused or a person that is confused will find failure. So if anywhere in the team there's any kind of confusion, there's a high chance that there's going to be failure on the treatment plan for the horse.
Absolutely.
And ultimately, we're all trying to help the horse, but the horse is the one that suffers. So thank you so much for your input. That is very good. So we are going to get you to treat all our feet and all our hogs for sure.
Excellent. Looking forward to it.
Thank you very much. This is Alberto Rullan and Dr. Colton Ramstrom with Performance Equine Veterinary Services. I hope you enjoyed. If you have any questions, comments, or concerns, drop us a comment so we can talk more about the issues that you want us to talk about.